Austin.
How we doing?
Welcome to LIVV's new podcast. Tell us a little bit about your story of how you got into LIVV and how you're trying to take care of your shoulder.
Yeah, absolutely. So starting about October, November, started getting really bad pain all throughout my shoulder. Put it off for a little bit, figured I'd just sit there and rest. Pretty injury prone, been through this a couple times throughout my life. So I gave it a few months during the holidays. I was traveling a lot. And then starting around January, I started trying to work out again. I couldn't do anything. It was to the point to where I was getting pain all through the back, the front, right up here in my clavicle area. Couldn't even do push-ups. And I'm somebody who, like to be in the gym 4, 5, 6 days a week. So it got pretty annoying. Went to get my MRIs done, x-rays done, and all that. And it was a laundry list of all these things I had going on. Half of it you had to explain to me, right?
Yep.
And then I saw 3 different orthopedic surgeons, and that at the end of the day, they all had the same recommendation. We need to go in there, perform surgery, cut off some bone, do a cleanup. Supposed to be like a 6-month recovery, just nothing I wanted to go through. I've already had 7 major surgeries throughout my life, and now I come to find out a lot of these could have been avoided. So what I did, and I was talking to Noelle, your cousin, one day, and she kind of mentioned this, and then I knew you'd kind of started something, but didn't know anything about the type of therapies and things you offered. And then I came in and saw you. You showed me that there was another way to handle this.
Yeah, tell us about the procedure, how long it was, what we actually did, and how it helped.
Sure, so I'm sure you break down what PRP is more. I had no idea, so I come in, he does a little blood pull sitting right here, puts in some centrifuge, and then all of a sudden I got, I think it was like 8 pretty big shots that were gonna go all throughout. But yeah, you just numb me up. I'd say the procedure couldn't have been any longer than 45 minutes to an hour. Was pretty sore for a couple days, naturally. Felt heavy, felt even in more pain. And after about 2 weeks, I was back in the gym. That was what the craziest part to me was an hour worth of therapy and some injections, and I'm back working out, doing things I wasn't able to do for 4, 5, or 6 months. Compared to if I went the surgery route, essentially the same result, but now I'm down for another 3 months, then I got 3 to 6 months of physical therapy, and it just doesn't really solve the issue. All they were doing was putting a Band-Aid off of it because the joints rubbing together, they're just gonna shave some of it off. So that's not a solution. I wanted to do something that would be more beneficial for me now in the long run. It'd be a healthier way of doing it without undergoing the knife. So if you're telling me an hour of getting some injections done can solve a problem I was having for 6 months, that's what kind of blows my mind about this whole thing.
Coming in, having that pain, not able to work out, not able to take off your shirt, how much better are you now? It's about 2 months post-treatment.
Yeah, I think we're 7 weeks. 7 weeks was this past Friday. Like I said, I'm doing the things that you take for granted on a day-to-day basis, right? Things that, like I said, take it off your shirt, doing simple things like push-ups. Just being able to do those simple things is a big deal to me. But I'd say overall, in just 7 weeks, I'm probably about 80, 85%, which says a lot. That's not something that you can typically, when you see a list of injuries that big and past ones I didn't take care of and tears and fluid pockets, and I had a cyst somewhere, I think. For all of those to be solved with simply doing this, it's pretty cool to see how it can happen so fast, and I'm back to living a normal life. And then we can do our follow-ups and really focus in on where we go from here. But at the end of the day, I avoided surgery, and that was my #1 goal.
That was huge.
Yeah, absolutely.
Huge. Any recommendations for people with any joint pains, or you've had multiple injuries,
Yeah, so
you would go?
Something else that we've talked about is from mistakes I made in my early 20s. I haven't actually been able to run for about a decade. I have dead muscle tissue throughout my shin compartments. We've talked about that and did the research, and that I could potentially be able to run again from doing these things, but I underwent the knife 3 times already for that. Something, again, I could have probably avoided, So if it's joint pain, knee pain, recovering from past injuries, whatever it might be, look at something like this first. Go the natural route, something where you can give your body to self-heal almost, then undergoing the knife. The second you do that, you're done. You're done. You can't really go back from those kind of things. my mom, my brother, he just had a bulging disc in his back, and they're saying it's going to be real bad. I sent it to somebody in Arizona who does something similar, and they're saying this could help him. My dad's had knee problems for the last decade. This would be something he hasn't been able to run either for different issues, but I mean, this is the type of thing that before you ever go into these extreme circumstances we always seem to put ourselves in, look at the more natural route too, because I recommend this all day long. I even posted about it, you know. So I feel very strongly that this is a real solution for people that it's not talked about enough. It's not talked about enough.
For sure. Thank you, Austin.
Absolutely, appreciate it.